Welcome to Mental Health Matters. I'm Barbara Myers. On today's show, we have the honor of talking to members of an organization called Interrelate, an international coalition of national consumer user organizations. They're in town to go to an international mental health conference, the International Initiative for Mental Health Leadership. Our first guests are Anne Beals from England. Anne is a member of the National Survivor User Network in England and Director of Service User Involvement in an organization called Together. She works for the well-being of those with needs specifically related to having mental health problems. Welcome, Anne. Next we have Jenny Steed from Australia. Jenny has worked for many years within the Australian mental health system, within the mental health consumer movement, and with people who have been criminalized due to mental illness. Welcome, Jenny. Later on in the show, we'll have two more guests. So I'd like to talk with you first, Anne. Could you tell us a little bit about yourself, how you came to be a person who has accessed mental health services, your story?
Yes, I was kind of quite troubled at school, actually, so it started quite a long way back. And I had an adolescent that was like a roller coaster. And eventually had a breakdown in my 20s and received services and support then. And then kind of found they weren't that useful or helpful and hid from services for a very long time. So my mental health was kind of supported mainly through medication and hiding from the stuff that was going on for me. Eventually my breakdown in my 30s was so severe that I had to accept that I probably needed to access services because that was about the only way I was going to survive. It was kind of life and death at that point. And so I did access services unwillingly and didn't like to. However, what I started to realise was that by admitting that I had some issues and problems and that my life wasn't going the way I wanted it to and that I had so many troubles and challenges, my friends started to rally round. And in actual fact, that was when I first realised that it's through the friendships I had and the support through that.
The relationships that really make a difference.
And I guess it had such a profound impact on me, the comparison of what I was offered as by professionals around support, having been a professional myself, and then what I was offered, the warmth, the humanity, the real caring, the 24/7, people didn't go away if they're friends, they stay. And it was that support that started to really make me realise that there had to be a better way.
How did you become active in the national mental health survivor work?
Well, as all good things, there was no plan for it. It was a complete accident. My last severe breakdown, I couldn't work, so I ended up setting up a business, which sounds a bit odd, but that's kind of how it went. And I did training and consultancy. And I ended up training a lot of people in West Sussex in England around they wanted to speak up and have their say around improving services, mental health services. And when I met that group of people who wanted me to train with them and they were going to pay me freelance and so on, it was like coming home. It was like meeting a group of people where I'd always belonged. I felt totally accepted, not judged, not assessed in any way, and actually valued and respected. And I was able to offer them some techniques and learning that I'd had along my journey around being trained and speaking out and so on and so forth. And I understood the health system because I've been a professional in the system. And so it worked out that we started a self-help group without even calling it that. We had no idea what it was called. We didn't have the language in those days. That was 15 years ago. So that was my first experience of coming home and starting to be active in the service user movement. And I think, looking back, it probably started at school where I couldn't bear bullies. So I think I've probably always been up for sticking up for people's rights all along.
So that's where you get your passion for this?
Yes, I think the passion comes from being active in the service user movement. It's helped me get well and stay well. I'd like to say that I do it because it's a good thing to do, but it's quite selfish. It's helped me get well and stay well.
Yeah.
So my passion comes from if it's worked for me, I just want to make sure that as many other people get access for it to work for them.
Can you tell us about the organization called Together and your work?
Yep, Together is a very old mental health charity in England. It's about 137 years old, I think it is. And the original founding member, Henry Hawkins, was a philanthropist, and his vision was to say that people who had mental health problems, obviously the language is very different when he set it up, but basically he said that people deserve the right to have ordinary associations, and if they were successful in having ordinary associations, they would be successful in life. And to a certain degree we're still trying to achieve that as a national mental health charity in England. We provide a lot of services, a huge range. We provide advocacy in the high secure hospitals, of which there's 3 in England, right through to supporting people who are at work to stay at work. We have a new peer support service, 2 new peer support services where people can almost self-refer, meet other people who've been through very similar experiences, feel that solidarity that helps them move through their distress. Now within that organisation, I'm fortunate enough to be called the Director of Service User Involvement, which is slightly different language to other countries, but consumers being organised to improve services, to have a say around the system, to be able to influence policy at a very local, regional, and to a certain degree by linking into the National Survivor User Network at a national level. But the main thing is that we, in our directorate, the main thing is that individuals can be in charge and in control of their own recovery and their own well-being. The challenges are, at the moment, we're seeing cuts in the resources that are available to us, absolutely necessary resources, resources that make our lives worth living, resources that save our lives. We're seeing those resources being cut.
Because of the economy.
Because of the economy. So our struggle in the movement is to do 2 things, is to say, is this not an opportunity to say to the status quo, the medical model, for instance, it's time for me to stand aside and let our new ideas, our ideas of what works for us, they're not just ideas, we know what works for us and what doesn't. Can this not be an opportunity for that to have an airing, for that to be an opportunity for us to express and deliver something that we really value? And is this not time for us to say, let's put aside this idea that processes and systems meet our needs? What will always meet our needs is humanity and contact and being connected to ourselves, connected to our loved ones, connected to our community. And if the movement isn't able to help the National Health Service and the providers understand that the systems and processes they're spending all their energies and talents and time on, that they're not what helps us. What helps us is the delivery of humane contact, connectivity. And so I think, although it's a rough time, it's an uncertain time, I think it's a time of opportunity.
Yeah, sounds like that. Wow. Okay. Well, thank you. Jenny, could you tell us about yourself and where your passion for doing this work comes from?
Sure. I also was troubled as a young person, but managed to keep one foot going in front of the other for all of the time that it was absolutely necessary. So while I was raising children and building a career and constructing a life for myself, I managed reasonably well by just ignoring what had happened to me in the past. But once the children had grown up and left home, and the work that I was doing was very challenging, and I moved into a new area where I didn't have the sorts of friendships and supports that I was used to, I totally crumbled, and I didn't work again after that for 5 years or more. And what helped me to get back was actually not so much directly working within the mental health consumer movement, but working within an organisation that provided advocacy and support for women in the criminal justice system. And I really owe those women, the incarcerated women that I've come to know and love very much. It turned out that the job that they wanted me to do was to do research into post-release mortality, that is, women who died within a short time of being released from prison, and an enormous number of women were in that situation. When I told my family and other people who cared for me about that, they said it was a very bad idea. You know, it's too tragic for you to be involved in. But in fact, it was a very good thing for me to do. And my association with Sisters Inside is where I learned the values that, I suppose they're the same values as have driven me all my life, but I learned ways of articulating those values that are also the ones that we hold dear to us within the consumer movement. Subsequently, I've moved in and out of roles within the mental health consumer movement. I've done statewide consultations around the establishment of mechanisms to inform government about mental health from consumer and carer perspectives. I've worked in national disability organisations, but I always keep coming back to Sisters Inside because that feels like my home.
So do you visit the women in prison?
My role these days is less to do that than to provide supervision and caring and mentoring for staff and also for students. We feel that it's important for us to influence the way future generations of the caring professions of one sort or another approach things. The values that we hold in Sisters Inside are sometimes seen as quite different from the values that apply in a normal casework model of providing support. So we don't see ourselves as expert. We see the women that we're working with as experts in their own lives. As far as mental health goes, I've recognised for a long time that everyone can get better. I mean, I certainly have, and I don't know anyone who looks as though they're not going to be able to at some time. But in order to do that, we need a few things. We need to have hope. We need to be connected with other people, and we need to be in charge of what's happening to us. Traditionally, the medical model of the mental health system has worked in exactly the opposite way. It has denied us hope. You know, if you're not well now, you're never going to be well. It's isolated us. It's taken us away from the rest of our communities, and it's made it impossible for us to be making decisions about our own lives. So much of that form of treatment is involuntary. And this is also the way that we work with criminalised women. They need to make decisions about their own lives. So our workers can't say, well, the most important thing for you to do now, Jeannie, is to get somewhere to live, get a job, blah, blah, blah. You say, well, you know, what's important for you? And they might say it's important for me to have a dog. It's important for me to feel like there's somebody who loves me. You know, we might say, well, it's going to be hard to get somewhere to live if you've also got a dog, but if that's what you want, we'll work with you in order to achieve it. So people need to be making their own decisions.
Yeah, that's sort of that. Thank you for being here, Anne and Jenny. We enjoyed talking with you about this. We now have two other guests. Hrannar Jónsson from Iceland, who is a member of HURAL, an association formed by people recovering from mental illness. He is the voice of the recovery movement in Iceland and works by doing education on recovery movement. Welcome, Hrannar.
Thank you.
And we have Dr. Dan Fisher, a psychiatrist from the United States, who has himself recovered from schizophrenia. Dr. Fisher is a speaker, teacher and researcher who travels to all parts of the country to conduct workshops, give keynote addresses, teach classes, and organize conferences to promote recovery of people labeled with mental illness. Welcome, Dan. I'd like, Her Honor, to start with you to tell us about yourself, what your story is, and how you became involved in this movement.
Well, I come into this movement as a person that has an experience of depression mostly. I heard some other names for it, but for me it was sufficient. I was a depressed person, and for many years people told me to do something about it. I had a sister who's educated in psychology, and she started to give me these books about undoing depression and what have you, and I would throw them into a corner because I was prejudiced, I guess, like many other people are. I didn't want to recognize the problem, but other people were saying to me, "Oh, you should do something." And for years this was the situation, but from like 4 or 5 years back, I was getting into a very, very bad spot. Things were becoming becoming more or less paralyzed, and not seeing any way out, and criticized everything I was, doing myself, and had a generally very bleak outlook towards life. And to make a long story short, I had heard about, there were some very brave people. They were writing articles in the newspapers back home about this thing called Hugarafl, which says mind power in Icelandic, and they were, they were like the recovery movement in Iceland, and so I thought, well, this is something for me, because I was trying different things, medication, but I was like suspicious of psychiatry in general, and so I became involved with these people, and so the person at my side, Dan Fisher, he's like, in a part he's responsible, because when our organization was formed 8 years ago, they were looking very much towards the model of recovery, and what they found on the internet was ideas of Dan and Judy Chamberlain, and he came there in 2006, and Daniel Fisher visited us 2 times, and so well, for me it was I recovered. And what the key to my recovery was to come into this community for one thing, and to many different things, but the community was very important, and the hope and the vision of that you
and relationships with other people. So incredibly important in recovery.
And to have just to see other people that to know other people that they were okay. They could.
Yeah, that's good. Well, Dan, it sounds like your work has been really inspiring to the work that he's done. And you yourself have come to this from personal experience of mental health crisis. Can you tell us what led you to do this kind of work?
Well, it was my own personal experience. And actually hearing about the movement in the 70s, that's when I first heard about it. And Judy Chamberlain, who ran our mention, was really a mentor of mine, along with Sally Zinman here in the Bay Area, and Jay Mahler. And these early leaders saw a vision of hope and of people taking control of their own lives that just inspired me tremendously and resonated much more than the treatment that I had, which, I was hospitalized 3 times, told I was schizophrenic and probably never recover. My family believed in me, though, and my friends, and one flew over the cuckoo's nest helped. And the tenor of the 70s, I'm really a child of the late 60s and 70s, and our movement as a whole started as a civil rights movement, along with women's rights and rights of people with other disabilities.
Right.
And so there was a foment sort of here in this country and other parts of the world. But we, as Rano and I were talking this morning, continue to struggle for rights that some other disadvantaged groups have obtained. And we have, in this country, I'm realizing from going to other countries, a history of self-help and of writing injustice that is kind of unique in a way.
I'd like to ask both of you where your passion for doing this work comes from.
Yeah, I'm looking at myself these days, and I'm amazed. I'm very, I like what I'm doing. I like, being in this kind of work, and I guess it comes from, I was in a situation where it was very, very bleak, and it was very, very not having a future, and to have hope again, to see life, to be passionate about things, and something big changed, and to see that change in other people, to see, hearing them tell their stories, and they become alive again, and that is something magnificent happens within you when you see this happening also.
And you help people, it helps you.
Yeah. And to be in touch with that, this is a quality of life that you don't see. And there is the sense of community. In my country, in 2008, there was a big economic collapse. And it was not just a collapse of economy, it's also a collapse of values in whole different things. And at this time, I was, entering into this movement, and I came into a community where people there, they had strong bonds. And when the community was collapsing all around me, and I came into this, and it was a peculiar thing. These people that were supposedly broken, they had the community,
They're the strong ones.
They were the strong ones, And it was amazing experience.
How about you, Dan?
Well, it's interesting, this story that you described about Iceland, I had a dream of that several years ago, that we were sitting in a circle, a self-help circle, many of us who were sharing our own experiences of recovery, and, sitting around, and around us, all the chronically normal people were going mad. And every once in a while they peek in and say, and they bring a TV camera and say, "What are you doing? What pill are you taking?" "No, it's not medication." "Well, what's your program?" "No, it's not a program. It's human to human, heart to heart."
I'd like to ask a little bit about Interrelate, the organization, how it was formed.
How Interrelate was formed. Yeah, well, I'm glad you asked. It was actually through this other organization that we're part of a conference of this week, in fact. It's called IIMHL, the International Initiative for Mental Health Leadership, which is a group that physically meets every 18 months and in different countries. And it consists of the administrators, government administrators of 7 different countries, U.S. and Australia, New Zealand, Canada, Ireland, Scotland, and England. I hope I got them all. But these countries have been meeting. So in 2007, they brought together leaders of consumer movements. And I think they should add the government representatives of Iceland, by the way, because we started as a connection of consumer groups from these 7 countries. And when we met, we realized how much we had in common. It was in St. Catharines in 2007. And I and several other leaders, Anne, who we interviewed, and Jenny, we said, gee, we should meet more often. We should connect. And we've done it through Skype. About every 6 weeks now, we meet through Skype. And then in person, we try to have as many of us as possible come to the IIMHL. And we met in, let's see, we went to, the next one was in Australia and New Zealand. Then 18 months ago it was in Ireland, and now we're meeting here, and 18 months from now we'll be in England. And this connection we find is so rich and gives us such additional perspective through each other's eyes. So like the struggle around recovery is a similar struggle. Leadership is a big issue, for instance. And we've done several articles together on leadership. And as we want in our movement to have a new form of leadership, we're trying more shoulder-to-shoulder leadership instead of, one or another person.
Can you give some examples of things that you've learned from each other?
What I've learned, just coming here, you see, like Dan was explaining before, we were meeting some people yesterday, and they were relating their experiences. And these are like universal experiences.
Yes, really. So there's a lot of things that are in common.
Yeah. Recovery in the United States, recovery in Iceland, it's the same thing. So it's like I can easily relate it to it. So I can come here and I say, okay, these are my people.
Yeah.
And it's a human problem. It's not a human experience. It's not a medical experience.
There you go.
Very good to have that reinforced, because we know it instinctively, individually, then small groups start to come to know it, and it raises our consciousness to another dimension.
Thank you so much for being our guest.
Thank you.
Thank you very much.
Yeah. Before we leave, I'd like to leave you with some resources, websites, basically, of organizations that we're talking about here. The Interrelate organization is at interrelate.info. The Together organization in England is together-uk.org. Hugrop in Iceland is hugrop.is/English. And then the organization that Dan is the head of is the National Empowerment Center in the United States, is power2u.org. So I'll let you have a chance to look at those websites and get inspired by all the work that's going on. In closing, I'd like to use these words from the Reverend Wayne Arneson. Take courage, friends. The way is often hard, the path is never clear, and the stakes are very high. Take courage, for deep down there is another truth. You are not alone. Thank you for watching. We'll see you next time.